more education and things like that. With that, just in moving forward, there's a couple themes that we've heard from your board and administration that we want to use the data. You know, everybody has feelings about benefits. My wife teaches. She's been a part of her local union. Most of our family is in education. We get it. I understand this. But when it comes to benefits, what we're finding is that usually good, credible data tells us the most about how to help a population that is covered. So your board and administration have realized that there's a lot of data that we can draw in and use to help us understand how you're using the benefits and how you're not using the benefits. And we'll show you some of that here today. It's your board's intent to do the most good for the most people. Benefits by nature are considered, oddly enough, a discriminatory benefit. If I'm sick and I use it a lot, I really enjoy the benefit. If you're healthy and don't need it, that's good, but I'm the one that enjoyed the benefit. So there's just this natural difference in how benefits are incurred and used. So we're trying to focus on the majority of your population, doing the most good for the most people, most all of the time at the best value. It is hard to be equal and fair. You know, the only way for me to enjoy and realize my life insurance benefit is I would have to pass away. Well, that's not much of a benefit, right? So it's hard to be perfectly equal and fair on all fronts. So your board and your administration is constantly trying to work with your representatives and make that as equitable as possible. And we'll show you how some of those numbers fare. Moving forward, your board is very committed to making sure that this information is available to you. So this PowerPoint slide will be available to you, and we'll come back and we'll answer more questions. Here's why it's also applicable to you. And we could look at a lot of different things, but I'm going to look at just two aspects of your benefit. In 2018, 77% of all the covered adults ages 26 and above here in your district did not have an annual exam. We found that surprising. The average cost of an annual exam is almost $200, actually about $177. So if we take a look at all the people who didn't get their annual exam, that's about $85,000 that was available to those people, but it was never used or realized. So that was just benefits left unutilized. At the same time, we know that last year, all of you collectively, together, spent over $300 of your personal income to pay for deductibles and co-pays and drug co-pays and things like that. And that's been the case for a number of years now. What we got looking at is that out of 617 employees, this is not belly buttons, not children, not spouses, but just the employees that are on your plan, only 77 of you took advantage of the Section 125 provision that is called sometimes the flex plan or cafeteria plan. The district pays for that benefit 100%, and if you put money in it, it lets you spend your money tax-free. But only 77 of you did that. And now those 77 people only ran about $84,000 through the plan. That left over $200,000 that most of you spent that had no tax benefit. At a 30% tax rate, we figure that's about $80,000, $90,000 of taxation that you could have avoided. So just in those two provisions right there, there's about $150,000 or more that you could have enjoyed that you either didn't take advantage of or you didn't take home. As benefits change, we think it's really important for people to be educated and well-versed on how to make the best use of your benefits. And as we're combing through the data, we're finding places in your existing benefit program that you might not be aware are available to you. By law, all of you can have a free annual exam at no cost to you. But 77% of you didn't use it. We want to fix that. Does that make sense? So today Brenda and I are going to cover these topics to try to walk you through some scenarios, some examples of how your benefits work, how they compare, and some best and worst case scenarios. And those are the extremes. So when we get down here to Brenda, I'll preface a little bit what you're going to see, but we want you to understand the continuum and the scope of how benefits will or won't apply to you. And then we can come back around to some of your building meetings and dig into more questions. Your board has instructed us, and along with your administration, to focus on a couple things. It is your board's desire that, on average, your benefits be better than most of the other school districts. In Iowa, there's about 330 districts. This year, we will be in front of probably close to half of them, and we regularly, in some fashion, serve about a third of all the districts in the state. So we've got some good resources to know if that's the case, and we'll show you how that's the case. Your board would like us to have benefits in place for you that reward you when you make better use of the benefit. For example, just getting an annual exam costs you nothing, but most of you didn't do it. So we want you to take advantage of that for preventive purposes, to avoid things before they become issues for you. We want you to take better use of some of the flexible spending account tools. There's no need for you to pay tax money and take home less of your household income when the district is paying for a benefit that will help you have more of your money to spend. We want to increase your knowledge and understanding of how to take use of that. We need to make sure that your total plans are solvent here in the district. Pricing has been an issue, cash flow has been an issue. There's things like that at the district level that the board has charged us to help prevent. We want to reduce the trend of health care here at your district. That isn't to say we want to reduce the impact and benefit to you, but we'd like to see you have to spend less money in the long run on average for the greater good of all concerned. And then the other thing is they've charged us to help make sure that the plans are compliant. A lot of you might be aware of the Affordable Care Act that was passed back in 2010 in March, and there has been a litany of laws that have gradually, continually changed what benefits must do, what they have to do, and what they can do. And so as we dig in, we want to continue working with your district.
Health insurance is designed to help you and your family cover the cost of your medical care, including doctor visits and prescription medicines. Similar to car insurance, you're responsible for paying a specific amount or premium each month whether or not you use any medical services. In return, your insurer will pay a portion of your medical costs should you or a family member get sick or injured. Keep in mind that your plan will likely require you to pay a portion of the expenses using your own money. These out-of-pocket costs may include a deductible, co-payments, and co-insurance. Now, a deductible is the amount you have to pay out of pocket before your plan will pay any expenses. This can include both medical and pharmacy expenses, meaning the deductible must be met before getting coverage for some or all prescriptions. So, for example, if your deductible is $1,000, your plan won't pay any of your healthcare costs until you paid $1,000 in expenses out of pocket. Once you've met your deductible, you may still have to pay a certain amount out of pocket for services. One type of out-of-pocket cost is a co-payment or co-pay. This is a flat fee that you must pay for specific health-related services such as a visit to the ER for an injury, a trip to the doctor when you're sick, or picking up a prescription from the pharmacy. For some services or prescriptions, your insurance might require a different kind of out-of-pocket expense called co-insurance. Co-insurance means you must pay a percentage of total costs rather than a fixed dollar amount. So, for example, a medicine might require a 30% co-insurance. On a $1,000 medicine, you would have to pay $300. Because co-insurance is a percentage and can widely vary based on the cost of a service or product, it can be difficult to predict and plan for. All health insurance plans are different, so make sure you're aware of what you may have to pay to see your doctor or access the medicines you need.
That's a quick overview to that, and your plan is one of those. Generally, you always pay the deductible first. After you pay the deductible, the plan shares the cost with you. You co-insure it, you pay a percentage, and the plan pays a percentage. And once your deductible and your co-insurance adds up to the out-of-pockets, you're done. The nice benefit you have here at Marshalltown is you have co-payments. And oftentimes, like with doctor visits and with drugs, the deductible is waived and you just can pay the copay. Some of your copays, as you'll see, are fixed dollar amounts, like maybe $20 for an office visit, or they might be a percentage. Maybe it's 20% of that particular visit to a given doctor. So here at Marshalltown, to avoid everybody from having to pay the deductible every time, the plan includes a degree of copays that we'll show you here in a minute. The one thing I tell people, and you can see it's got a star up here, we believe that the most important aspect of any health plan is the out-of-pocket limit. It's interesting, in my career, people get so concerned about their deductible, and I think it's because that's what we're used to in our car insurance, or maybe our homeowner's insurance. But in health insurance, the deductible is just one of the things you might have to pay. At the end of the day, it's the out-of-pocket that says, you're done paying and we'll pay the rest of it for you. So we're trying to get people to focus on the out-of-pocket because that's the tool that really protects your household income. If you have a high deductible and a lower out-of-pocket, you would find that worst case scenario, you would be better off. What we have found with a lot of schools in the state is people have clung to low deductibles, understandably. But without realizing it, they've moved into higher out-of-pockets. And that's where we're seeing a lot of teachers and families think they've got a better benefit with a low deductible, but they really have to pay a lot more money through the out-of-pocket. So we believe the out-of-pocket is the most important thing. We're going to show you how your out-of-pockets compare in other aspects as well. A primary care physician, just so we're on the same wavelength here, is generally your family practitioner, your general practitioner, family doctor. And on one of your plans, they ask that you denote that, and you've been doing that. But included in that category can also be internal medicine physicians, for the ladies, the OBGYNs, if you go to a clinic, even a nurse practitioner. Those are usually the first people you see. They're kind of the frontline medical community that you see. And we use that term a lot, so I just want to make sure you're familiar. If we throw out the acronym PCP, that's what it stands for. Another term you'll hear used from time to time is urgent care. All of you are familiar with what an emergency room is, or what a doctor's clinic is. But over the years across the nation, as health insurance has become more expensive, and the emergency rooms are usually very expensive, a lot of systems have put in place urgent care centers that kind of fall somewhere in between. You know, maybe it's not life-threatening, but your doctor's clinic can't get you in, so you can go to an urgent care facility. And right off the top of my head, I'm not even sure if Marshalltown has you do have. Is it the Unity Point one out here? Okay, so you're fortunate. Here in town, you do in fact have urgent care. We want you to take advantage of that because otherwise the emergency room is more expensive and it will cost you more as well. All of those terms get rolled up into what we call a bucket. And that bucket is the out-of-pocket that we want you to focus on as we talk about trying to protect household incomes and help you make better use of your benefits. In the world of health insurance, the term medical out-of-pocket, or OPM, which stands for out-of-pocket maximum, has been around forever. Years ago, and your plan used to be this way, you could go to the pharmacy and pay a copay every time you walk in. And those copays went on indefinitely forever. Changed. And now we see a lot of separate RX, or drug out-of-pocket. So it's not uncommon to have a medical out-of-pocket limit that we focus on, and also a drug out-of-pocket. Your plans are going to have one of each, as they pretty much have. Sometimes you can combine them, sometimes not. But when we talk about your out-of-pockets, there are two. And we're going to show you how those work going forward. Let me walk you through just some highlights of your plan going forward. There will be two plans. The same networks that you have been using for a number of years are the same networks that are in place. If you are enrolled on the plan today, some of you are enrolled in what is called your standard plan. It's a PPO plan, and that uses what we call the Blue Cross Blue Shield network called Alliance Select. Alliance Select is not a health plan, it's not an insurance company, it's the network you use. And it covers pretty much everything here in the state of Iowa. Almost all hospitals, I believe, are in, and like 99% of all doctors. And it links with networks across the nation with other Blue Cross Blue Shield plans. It's the broadest network available. It's one of the best networks available, and your administration and board felt it was important to retain the use of that network. The other network you have available to you with the other plan you're going to have available is called Blue Advantage, and that uses a network here in Iowa, also governed by Blue Cross, called the Whippy Health Plan of, the Wellmark Health Plan of Iowa. The acronym you'll hear used is Whippy. And it's very similar to the PPO. It goes by a different name. It has different contracts with it. And generally, okay, don't hold me to this to the penny, but generally you'll find, and we see this when we do audits, that the cost of care under the HMO network is usually about 6, maybe 8% lower than the cost under the PPO. And the difference is one has a different focus. The Whippy network, the HMO network, actually pays doctors a little bit more because they're incented to reach out and govern more of your front-end medical care. They want you to come have an annual exam. And so we usually see they pay hospitals a little less. So that's the difference here. On the PPO plan, it's just the opposite. Doctors don't get paid quite as much, about the same, but hospitals are paid a little more. The difference is, if you're someone, and Brenda will talk about this in a minute, but if you're someone that you want to go to Mayo, or you want to go to the Cleveland Clinic, or you want to go to the cancer centers in Houston, Texas, you probably will find that this PPO plan is a better fit for you, but it's also more expensive for the plan. Therefore, you'll see the cost is different and the benefits are different. You're going to be asked to share differently. Does that make sense? So for the deductible, for example, under your PPO plan, it's $1,000 or $2,000 single or family on the PPO. On your HMO, it's $500 or $1,000. Remember I said the deductible wasn't the only thing you need to think about? The out-of-pocket on those two plans is either $2,000, $4,000, or $1,000, $2,000 respectively. That's your medical out-of-pocket. The co-insurance is 80-20 on both plans if you stay in the network. You can't really go out of the network on the HMO, but a lot of you here have already found that network is quite capable and very robust here in the state of Iowa. If you go out of network on the PPO, it's a 60-40 sharing. You'll be asked to pay more of a percentage, yes, but your out-of-pocket is still $2,000 or $4,000. So it gives you the choice between the plans and within each of those plans to direct your care a little differently. If you need office visits, the primary care, typical family practitioner, under the PPO is a 20% copay. Whatever that office visit cost is, you'll pay 20% of it. And that's the same way for specialists. The difference is we know that most specialists are usually 2 to 3, sometimes 4 times more expensive than a general practitioner. So if you go see a specialist, you'll pay 20%, but it'll be more money because their cost of services generally is much higher. On the HMO plan, it's either a $20 copay for your primary care visit, or it's a $35 copay to see a specialist. So it's a fixed dollar. Some of you prefer the fixed dollar amount, and some of you are happy to go with the co-insurance. So you just have to decide what's best for you between those options. Your drug utilization. There is another category called Tier 4. Tier 4 is considered to be limited value drugs. What's a limited value drug? And I'll use myself as an example. I require the use of statins. I'm post-heart attack, and so they put me on Zetia and critical. I'm telling you guys, ED do not fall in specialty drugs here. And here's the thing. Out of 1,500 people covered on your plan, and we don't know who you are, but there's only about maybe 4, 5, or 6 people here in the entire district that require the use of specialty drugs. Going forward, to help reduce everybody's cost on that, yours included, the plan is going to ask that when you obtain them, you get them through the Hy-Vee Pharmacy Solutions or the CVS Caremark Specialty Pharmacy. And if you're one of those people and you have to go to the clinic, the doctor's office, or different facilities to have injections or things like that, they are very familiar with how to continue to help you getting those drugs in an affordable way. And it just kind of depends on where it falls in the tier in terms of what things will cost. Does that make sense? Thanks for laughing. I was getting worried you weren't enjoying the presentation. But usually the drug thing gets everybody sooner or later. So I want to talk about some benchmarking. You know, as your board and administration challenged us, you know, change is hard, but challenged us towards being better than average. We decided it would be important, and we do this with other school districts, as we compare you to a couple of credible sources that we like to use here in the state and nationally. The Kaiser Foundation, you may be familiar with, is a huge organization benefit for you to retain. If we look at that same thing on the HMO, it's a $20 copay, which fits nicely with what we see in the state, a little better than average. And the 35, I will tell you, yes, it's more expensive, but it is trailing where we're watching the market go and where we're seeing some even other schools, in our case, have to move into. So we, again, was trying to be a little bit better than average. Your drug co-pays, as we talked, are $8 tier 1, $20 tier 2, $40 tier 3, $60 for tier 4. And those are just about at or a little bit better than what we see. Notice the NAs here. We are seeing a lot of employers and even school districts, even hospital and doctor clients that we serve, simply not cover tier 4 drugs at all. The reason is most any drug in that category is usually classification-wise, an equivalent or near equivalent is available in tier 1, 2, or 3. So over the next few years, you're going to see tier 4 drugs increasingly fall out of favor and not be covered. That is a highlight of what is happening going forward. Brenda Plants is with me today. She's our vice president. Brenda has run a claims department for Wellmark. She's done all the operations in the background with Delta Dental. She's served insurance companies.
Benefits are. Granted, there's a lot of details that we can't get to in today's meeting, but we do want to kind of just now go forward with that and say, okay, what would the best in case and worst case be? And the examples that we're using here today is if you are currently enrolled in the district plan, the amounts that you're going to see up here assumes that you've been enrolled. If you're brand new to the plan, you've never enrolled before, but you're going to, then the contribution amounts for you are a little bit different, okay? So please know that this example may not fit you exactly, but if enrolled today, then the amounts that you see up here will be consistent with your contributions going forward. The total premium, and I put this up here just so everyone understands the value that's associated with health insurance. I think we all know it's expensive. We watch the news, we know that. But just so you know what the total premium is between what the district pays and what you pay for each of these plans. Okay? It's $584 a month for the standard plan, or $7,000 a year for single coverage. Okay? On the HMO plan, it's $596 or $7,152 a year. It's a lot of money, obviously, a lot of money. The difference between the two plans, $12 a month or $144 annually. So that's the combination, so keep those numbers in mind. That's the total between employer and you, what you pay.
Excuse me, you guys put this all together for us.
The total cost is $7,000, but we also know if you're on single coverage, the district is paying that full amount. Regardless of which plan you select, the district pays that full amount. So when we're looking at the standard plan, the best and worst case scenarios, we have to keep in mind the terms that Mark was referring to before. So for single coverage, an employee pays for single coverage out of their paycheck, $0. That's great. The district covers the premium. Okay? The single out-of-pocket maximum, the medical out-of-pocket maximum, is $2,000 on that plan. So if you have a catastrophic year, you have a lot of claims, the most you're going to pay out of your pocket in a year's time for on single coverage for medical care is $2,000. The RX out of pocket, remember, you have two, you have a medical out of pocket and you have a prescription out of pocket. So again, if you had enough copays, you had enough prescription drugs, and you paid those $8 copays and a $20 copay or whatever it may be, if those added up to the total out of pocket for prescription drugs, the worst case scenario would be $3,000 for a single contract. Now that's a lot of copays. It would take a lot of copays to get there. Okay? So the best case scenario, if you have a single contract here and you're on the standard plan, the best case scenario for you is nothing out of pocket because you're not paying out of your paycheck. The district's paying it. Okay? And if you had absolutely no claims or no prescription drugs, you would have nothing out of pocket. Now, I would encourage you to continue to still go get those preventative exams. Okay, you may not have any costs, but please do go get those preventative exams because they're paid for 100%. But the absolute best scenario would be no premium, no claims, no money out of your pocket. A worst case scenario, and Mark just said it, this is going to apply to probably 0 of you, okay? But an absolute worst case scenario in a year's time would be that you met both your medical out of pocket and you match your prescription drug out of pocket. That's very unlikely to happen as we looked at all the data for your particular group. So that would be considered a worst case, and the bulk of you that are on a single contract that take the standard plan, you're going to fall somewhere in the middle. So we look at the exact same scenario if you were on the HMO plan. Again, nothing out of your paychecks. You pay no premium, the district pays it. The out-of-pocket, the medical out-of-pocket on the HMO plan, on the Blue Advantage plan, is $1,000. Again, the prescription drugs are identical, so the out-of-pocket is $3,000. Again, best scenario would be nothing, 0. No premium out of your paycheck, no claims, no prescription drugs. A worst case scenario for you would be that you actually met your single out of pocket and your prescription drug out of pocket, or $4,000. So that would be a worst case scenario in a benefit period, and a benefit period is a calendar year. Okay? And this data is going to be posted and available to you. So that's the single scenario. We just sum it up here side by side so that you have that information, a best and worst case situation. And then that becomes time for you to think about how you use the plan. Which plan do I want to be on? Is the flexibility of that nationwide network, that Alliance Select network, important to you? Do you have any concerns about naming a primary care physician or staying within the Iowa-based network for the HMO? Okay. Almost everyone's going to fall somewhere between these best case and worst case scenarios. I want to walk through the same thing for a family scenario, a family situation. Again, this is just informational. This is to let you know how much the total cost is for family coverage. Okay. It's $21,024 a year for family coverage. On the standard plan, $18,300 on the HMO plan. And you can see that's what that is, a difference of about $2,700 between those two plans. That's the total amount for the benefits that we've described. The employer is paying the annual premium is stated here The amount that the district is going to pay on a family scenario is going to be the exact same amount regardless of the plan that you select. So the district will pay $10,800 a year for both of the plans, depending on which one you select. The amount of out of your paycheck, should you choose to select family coverage on the standard plan, over the course of the year, would cost $10,224. That's the total amount that would come out over the course of the year for the standard plan to cover your family. On the HMO, be $7,500 would come out of your paycheck over the course of the year. Okay? So that difference is, again, about $2,700. That standard plan is going to cost a little bit more, and it's because of the nationwide availability, the flexibility of that network. Okay? And as Mark said, it costs a little bit more. Facilities get paid a little bit more on that plan. When we look at a best and a worst case scenario, let's look at the standard plan first. An employee has to pay $10,224 out of their paychecks over the course of the year. That annual out-of-pocket for family coverage is $4,000 under the standard plan. That's the medical out-of-pocket for a family. The prescription is $6,000, okay? And no one person in a family ever has to satisfy an out-of-pocket by themselves. If you have a family of 6 people, only one person in that family has any medical claims or issues, they only have to satisfy the amount of a single. So please understand that no one person in a family ever satisfies a family out-of-pocket amount by themselves. When others in the family incur claims, then together as a family, the combination of family members make up the family amounts. Okay, that's important to understand. So in this scenario, the best case scenario, you are going to pay premiums to cover your family. But let's say your family's perfectly healthy the entire year, there's no claims whatsoever, perhaps except those preventative claims. So your best case scenario would be that you just have to pay your premiums, but you had no other out-of-pocket expenses. The worst case, and absolutely again, is going to apply to very, very few, if anybody, would be that you met the entire family out-of-pocket medical and prescription drug, and we add that into your premiums for a total worst case scenario. Okay. The HMO plan, we just go through the same numbers. So again, if you're covering family, you're going to pay $7,500 out of your paycheck over the course of the year. The family out-of-pocket is $2,000. The family prescription drug out-of-pocket is $6,000. Your best case scenario, no claims, no prescriptions for your family. All you would have is what comes out of your paycheck. A worst case scenario, I pay my premiums and I hit both of my out-of-pockets. So if I add those together, that would be my worst case scenario. Again, we put them side by side so that you can take a look. But you want to think about, how does your family use the medical plan? Is the flexibility of that nationwide network important to you? Do you want to be able to go out of state? Do you have family members living permanently out of state? Okay, that HMO network is an Iowa-based network. If you've got folks living permanently out of state, maybe the PPO is better for you. Again, think about whether or not you want to name the primary care physician. for each family member. And that's a benefit as well. You get to name each person, it's their own PCP, okay? Again, most of you will fall in between these scenarios. And finally, there's one more tier of coverage, okay? It's the 2-person. It's employee plus 1. And we want to make sure that's really defined and people understand that, because it is designed and intended to cover 2 people. Either the employee and a child, or an employee and a spouse, but not an employee and 3 or 4 children. If that's the case, that becomes family. Again, just to look at what total premiums are for a 2-person coverage. The standard plan, the PPO plan, is the only one that's going to offer this level or tier of coverage, okay? Plus 1 or a 2-person coverage. And that's the way it is today. There's no changes to that. What we've done is go ahead and put up here for you for comparison what the 2-person amount would be, and then let you compare it to the family amounts. So the 2-person plan, or 2-person coverage under the standard, that's the only place that's available, the total cost of that plan is almost $13,000 a year. You can compare that to what family coverage is, $21,000, or the HMO plan, family coverage, $18,000. I didn't hear the question. This is the, no, I'm just talking about total cost. I'm coming to that. Next slide. Thank you. The employer paid, okay? The annual premium, district's cost per employee. We already looked at these numbers on the previous slide. The total amount that the district's going to pay for that 2-person coverage is $7,152. Recall, if you have family coverage, this is what the district's going to pay. But for the 2-person coverage, the district will pay $7,100. The employee, over the course of the year, via your paycheck, you will pay $5,820. Again, only the standard plan, the Alliance Select PPO plan, has this 2-person coverage. For that 2-person, out of your paycheck comes the $5,820. Should you meet the out-of-pocket medical, the out-of-pocket prescription drug, your best case scenario would be that that didn't happen. You would just pay the premiums, but your worst case scenario would be that you add in the medical and the prescription drug out of pocket. And a worst case would be $15,820. Again, if you take this plan, the bulk of you are going to fall somewhere in between. This is simply for comparison to family coverage.
So if you were on the employee plus children before, and you're going to have to move to family, are you considered already, do you have to pay the new premium rates or the grandfathered rates?
No, the new rates will apply to everyone as of July. Oh, okay.
Answers immediately. And now, that goes for your personalized health insurance information too. The fresh, redesigned, and secure My Wellmark provides you with a transparent, big picture look into your healthcare use, anytime, anywhere. Take a look at the enhanced at-a-glance claims view. You can track detailed claims information that provides the specifics you need. Plus, Plus, you'll easily find new and past electronic explanations of benefits, which are stored for 2 years using handy filters. No more holding on to all of those paper copies. If you want to know information relating to your specific coverage, it's here. Quickly see how much you've spent to date, including breakouts for deductibles and out-of-pocket maximums. You'll also find easy-to-understand language and clear-cut details if you'd like more of an explanation. My Walmart can help you understand and get the most from your health insurance benefits with relevant educational articles, how-tos, tips, tools, and more. Plus, you're able to find in-network doctors and hospitals, estimate costs, and so much more. Even with all this information at your fingertips, you still might have a question. No problem. Get the answers you need by contacting Walmart when you want with the secure Ask a Question inbox. My Walmart can even help you replace a missing ID card too. It's simple. Get your digital ID card and print it out, or order another card with the click of a button. And it's easy to access all of these features with one-touch fingerprint or facial recognition authentication for the mobile app. To put it simply, the new My Walmart will streamline your health insurance information and make it easier to find the items you need when you need them. Visit mywalmart.com to log in or register today.
So if you have encouraging you to, it has a lot of resources. You can be on it, your spouse can be on it, your kids can be on it, and it offers you a lot of important dates to remember. Your open enrollment period is from April 29 to May 24. That's almost a month. That's longer. With all the changes going on and our need to get back to you and answer some questions about what does this mean to you. We know the administration wants to allow more time for your decision-making to weigh into what plan will be best for you. If you're currently enrolled in the premium PPO, you're going to have to make a plan change. So you'll have to decide which one you want to be in, and everything that you've spent to date in this calendar year is going to roll forward and you'll get credit for it. So you're not losing credit for the deductibles, co-pays, and out-of-pocket expenses you've already had. It's your opportunity to change. If you want to change between plans, add someone, take someone off, whatever, this is your opportunity to realign how you're enrolled. I'm trying to think, Paulette, is there anything specific you want to address other than one thing we want to realize that May 24th is kind of a hard date. We'll need your paperwork stuff in by then to make sure everything gets set up for you and to be timely, to make for smooth transition for claims and coverage and things like that. We don't want anything to fall through the cracks. So do give some attention to that timeline. Know that we're going to be around to answer questions for you. Take advantage of the Wellmark tools, okay? Paulette already put out an FAQ. We're looking at some other videos, materials. There was some helpful stuff as you came in, if you came in from this side, that will tell you how to enroll and things like that. Complete an enrollment form with your plan choice, your decision, or your decision wave coverage, and you need to get that to Amy by the 24th. So she's going to be tracking you down, so make sure you get that in. And again, there's going to be some additional meetings that we're going to be conducting. We want to come back around if we want to allow more time for questions. We know this is a little compressed today. That's the spirit of the intent. Before 1,300 hours, what questions might you have that we can address for you? Yes, sir, in the back. And I'm going to need a claim. Total premiums, total claims, reinsurance cost, ACA fees, all those things. We've kind of been through that already at some prior meetings, so I'm not prepared to cover that here today.
What's the premium used for? It's not the premium have to go used for claims, correct?
The
for plan costs. It's got to be for plan
The premium, the term premium, is representative of the total rate for the plan. The plan legally has to put forth a rate by law for COBRA purposes, and that premium covers claims, admin fees, ACA fees, some of the Iowa taxes that are imposed. There's a plethora of things that add up, I think the total cost of the plan was about $7.5 million. But sir, if I could, those discussions have already occurred with other representatives, and the board is really here to try to address what we presented here today.
Why the premium's going to be another $3 million?
Yeah, well, I can answer that for you. One is your claim costs have been going up about 26% per head. So the fact is the cost of claims is going almost 3 times more than the industry average. Second reason is, with some of the ACA laws, the district is going to have to cover a number of people that were not extended coverage previously, and we know that's another $1 million. So if you just, if I could back up to some of the meetings we've had with your representatives and board last fall, I'd be happy to walk you through the explanation of those things. That's totally open. Some of that is in a PowerPoint that's been revealed and shared, so I'd be happy to go through that with you. But out of a courtesy to the group, if we could just stick to the things that we're covering here today. Your question is about the terms of your retirement and what you have had to pay in the past in regarding what the new cost will be going forward?
Yeah.
Were there different arrangements for different retirees?
Everybody, well, several of them are going to be different. We are in the process
Okay.
of going through all 16 retirees on a
16 retirees.
16.
There's an effort right now to answer your specific question and along with all other retirees. So I don't have that information today. But you're not alone because there's many classifications in the district, certified, non-certified, and retirees. So an explanation for how it's managed.
I'm also a retiree, and we have the meetings in the building, so we also have a meeting for us retirees to come to ask more questions.
Yeah, absolutely. Yeah, absolutely. We want to make sure everybody has a chance to answer all of, get all their questions answered. And it's just going to take a lot of time because there's so many of you in different scenarios. And so I know your administration is working with us to walk through all those so you can see. Questions about the state, that might help. Let me back up. If you're out of state, if you're living out of state, these plans will cover you. But you're going to want to think carefully about which plan you're on. You might be better off and better served being on the PPO plan if you need out-of-state coverage. And it's going to cover hospitalization, drugs, and everything just like you were if you were living back here in the state.
We're out of state on vacation. It will cover.
If you're, yes, it will cover you if you're in an accident out of state, regardless of how you're enrolled. If you're an eligible member, in-state, out-of-state, single family, you're covered for those types of situations. Medical emergencies are covered out of state because you can't always pick when you have a car wreck, right, or a heart attack. The HMO covers emergency services nationwide, I would argue worldwide. It's your choosing to make elective care, you need to stay in the network. But if you're out on vacation, you're covered. And I'll go one step further. If you have the HMO coverage and you got a student that maybe lives out of state, we'll explain some ways you can have a guest membership in other parts of the country as well. Because a lot of you want to be on the HMO here, but you might have a student living elsewhere. We'll show you how to cover that. Since we do so many of these, we try to show groups like you, your industry, your state, plus nationwide comparisons so you can kind of see apples to oranges. Is that what? Actually, we did, yeah. Well, you're good. There's about 3 questions rolled up in one. Let me take those for you. That's good. No, that's good. I appreciate that. First, we did not compare salaries. This is not a salary comparison, nor are we hired to do compensation comparisons for you. So that wasn't on what we did.